If you've lived in a cave your whole life, you never went outside, you never felt sun on your skin, how could you ask for it, right? Maybe there was a few cave women that went out, felt it, and came back and tried to tell the rest, but who knows, right? When you've never experienced something, how can you say, that's what I need, that's what I deserve, and this is unacceptable? This darkness is unacceptable. And what I think is happening is that we're destigmatizing women's health. So now we're starting to see stuff, especially on TikTok. So I actually wrote patient empowerment through TikTok. TikTok is a crazy tool that I think is actually bursting down the walls of women's health stigma. So we are learning about our periods. We're learning about fertility. We're learning about ovulation. We're learning about menopause. Women are more likely today, this is like a recent statistic, women are more likely to go to TikTok and learn about menopause than they do on Google. And that says a lot, because there's another statistic that's people under 30 are more likely to TikTok search a medical question before they Google it. That I can accept. It's generational. The fact that menopausal women over 45 today, of whom TikTok is something their kids are on, right? Not necessarily them, are using TikTok as their main source of information, tells me something about all the other sources of information and how woefully lacking they are. And so I think that we're having this deep education, destigmatization of women's health. And now we have the rise of FemTech, and there are new solutions coming to market. And women are saying, this is BS. I know the sunlight is outside this cave and I want it. I want it all. And guess what? I freaking deserve it. And I'll change doctors. If you're a doctor who wants to keep me in this painful dark, you don't want to give me pain medication, you don't believe me when I say I think this infection is not gone away yet, you think I'm overreacting when my cyst bursts, when you tell me menopause hot flashes is just something, right? Like, I'm done being gaslighted and I'm ready to move out into the light. And the doctors that are having pain medication treatment regimens, the ones that are innovating and using new medical devices that don't hurt as much to insert your IUD, ones that are asking women about their birth control lifestyles and like, what do you actually want from your birth control, and believing them when they say, here are my symptoms. They don't question it. They believe the patient and do what they want. Those are the doctors that are going to be successful. So I'm really obviously very excited about that. I had a few TikToks go viral this year. One of them was a demonstration of a new medical device called Aspivix. So Aspivix is replacing the tenaculum. So anyone who's ever had an IUD inserted, it is incredibly painful. So essentially, you have the uterus, and at the bottom of the uterus, you have the cervix. The cervix is what I like to think about is like kind of the knot on the balloon, right? So it kind of keeps the air in the balloon, or the baby in the uterus, if you will. And to pass the cervix, it's a very tight little loop. It's a little hole. To get through that, and with an IUD, you need to stabilize it. You need to hold it still so it doesn't wiggle around. You don't puncture anything else. And what we use is this thing called a tenaculum. It's these metal forceps that clamp down, not only just pinch, like they literally have a clamping effect, like a wrench that like you can clamp and then leave it. That's what it does. It clamps down, and it has a rigid edge, clamps down on the cervix and causes a massive cramp in the cervix. And that's what they use to stabilize it and insert the IUD, or go in there for a uterine sample in case they think you might have a fibroid or cancer or anything where you have to pass the cervix. This is what they're doing. And it is causing incredible amounts of pain, right? And Aspivix, what they've done, super cool. It's like a little smiley face, a little half moon, and it uses suction. So you just slides into the vagina, goes right up, sits next to the cervix. You pull, it creates suction. It holds the cervix in place. Their clinical trials showed, I think it was like 70% decrease in pain levels. Totally stabilized cervix, as well as the forceps did, and or the tenaculum, and they were able to IUD insert. So I did a little demo of this company's device and put it on TikTok. To date, it has like 3.8 million views and 5,000 comments. What that tells me is that this is a major pain point, and people are very engaged and excited for this is to be something that's fixed.